Next witness, 1 minute.
Thank you very much, Chairwoman Mitchell and members of the committee. My name is Connie Arnold. I live in Elk Grove, and like the previous speaker before the last one, Peter Mendoza, I used to be on SSI. And I don't think I could have survived on SSI if I didn't have access to low-income subsidized housing. Because the rates were so low for SSI that I remember when I lived on it that I would cry a lot of times because I didn't even have money to go to a movie. And that's a wrong position. These days, because SSI is supposed to be covering food, clothing, and shelter, which is basic necessities, and let alone now it can't even cover rent. And you have newly disabled quadriplegics that are going straight from the hospital to the nursing home because there's not enough money to pay for rent. There's not enough very low income accessible housing for those individuals out there, and they can't easily transition out of a nursing home back into the community. So, you know, we pay to house prisoners and pay for their food, clothing, and shelter in prisons up to $60,000 a year for one person. And yet the person on SSI, an SSI grant, has less than $12,000 a year to live. So I think we have some problems, and I would just like to ask that you support reinstating the full COLAs pass-throughs to people when Marty Emoto with Disability California.
10 seconds.
Okay. Community, CDCAN, you probably all know Marty Emoto. He said that SSI was, for 16 years, they kept taking the COLAs away. And that was probably many years ago. Back in, one last thing, in 2009, SSI was 907. That was, what, 7 years ago? Now it's being proposed to be 907 again. So I think we have problems because it should be above the 907 amount. So please restore it to a level that people can afford to have rent, food, and clothing. Thank you very much.
Thank you very much. Again, I'm going to remind witnesses to please be succinct. 1 minute. Feel free to say ditto what your colleague before you said. 1 minute, please.
Senator Mitchell, we love your questions. Members of the committee, we appreciate your attention to this matter. My name is Fran Smith. I direct the Public Authority in Yolo County. Makes me a member of the California Association of Public Authorities, and that puts me on the California Alliance for Retired Americans, and they all say ditto. But as a human being living in California since I was 15 years old, it used to be the great state of California. People on SSI didn't give away their COLAs. The state took it. They're now forced to live below the poverty level. Don't do it anymore. Whatever formula, whatever policies you need, figure it out. Give them enough money to live on.
Thank you so much. Next witness, 1 minute.
Madam Chair, members, Gary Passmore with the Congress of California Seniors. I'll be really brief. The first point I want to make is to say thank you for this hearing. It's been a long time coming, too many years that I've sat here in this issue, and the problems in SSI, SSP have just been kind of swept under the rug. Second thing I want to say is that these are among the most vulnerable people in this state, and they deserve better. The third thing I want to do is, as a challenge to you and the other members of the committee, I know each of you from time to time have thoughts about what your legacy is going to be while you're in Sacramento. And I would ask one or all of you to fix this problem. This program is broken in so many ways. We need to rethink the cash out. It bugs me that we leave over $800 million federal dollars lying on the table every year under our current system. So please don't drop this issue. Thank you.
Thank you. Next witness, 1 minute.
Madam Chair and members, Deborah Doctor from Disability Rights California, speaking in support of all the people who have spoken before me. Those of you who have been in the legislature for a while held your noses when you voted to cut these benefits, and it's time for you to do something that you can be proud of. As Gary said, for those of you who will be leaving soon or thinking about your legacy. And so I'm asking you to go way beyond the governor's proposal. Imagine what it would be like to try to live on this amount and give people the amount they can live on, along with the funding the advocacy that's needed to get people on the program. So there's a couple of asks in there, and I'm counting on you, and folks here are counting on you to do the right thing this year. Thank you.
Thank you. Next witness, please, 1 minute.
All due to respect to the panel, my name is Beverly Westbrooks, and I'm St. Mary's Senior Advocate. I'm on SSI also, and after they take $661 out of my check, I don't have enough money to pay for my medicine, and then plus I have to pay PG&E. So I'm asking the panel, can you please support this bill? And thank you very much for listening to me.
Thank you very much for coming. Appreciate it.
Hi, I'm Madeline Corin with Doc Fight here in Sacramento. I think many will agree that seniors have lost their voice in this country. And that's why I, as a low-income senior and a recipient of SSI, came here to say that nonprofit programs and charity for seniors are not sustaining us. In many cases, the elderly are running these programs with their own hands and with meager donations. Programs for seniors are also difficult to find and to navigate since they require referrals. When you find them, seniors are burdened with excessive paperwork and an invasion of our privacy. Also, the quality and quantity of service is very limited as well. This means that seniors pretty much have to forage for programs the way the homeless have to forage for their own resources. In all fairness, the nonprofits and charities try very, very hard. Nevertheless, seniors are still out in the rain when the umbrella programs for the poor are concerned. As our representatives, we implore you to stand up for low-income seniors by implementing the cost of living adjustment, or COLA, by raising the SSI and SSP to the poverty level and beyond.
10 seconds.
We have waited our turn and look forward to joining others in benefiting from the economic recovery our governor has achieved for California. Thank you.
Thank you.
Hi, my name is Kerry Whiteside with Hope and Justice with St. Mary's. I just recently got a rent increase of 50%. And SSI don't even help me to cover all of my expenses for the things I need. And I hope you support, and thank you for listening. And I hope you all act on it.
Thank you very much for coming. Appreciate it. Next witness, please, 1 minute.
Shall be a minute. My name is Bill Collins, and I'm very happy to be in this beautiful building. We don't have those many beautiful buildings that can be occupied by seniors. Simple help is to get the seniors that worked and made this country available for housing, because that helps Medi-Cal, it helps all the other systems. Without a house or a shelter, will you be able to live and prosper for this country? Thank you.
Thank you, sir. Next witness.
Rebecca Gonzalez, National Association of Social Workers, California chapter. We're here also in support to restore the cost of living increase and the grants. Last week, we brought over 1,300 social workers to California for our annual lobby days, and we chose this as one of our issues because we felt that this is a long neglected area of the budget, and we really needed to help join in support of restoring this program. Thank you.
Thank you. Next witness.
Maya Ingram from the ACLU of California, in support of all testimony that came before me and will come after me, to ensure that the SSI, SSP grant increases are restored and that the COLA is reinstated to provide this vulnerable population with financial resources to meet the growing cost of living in California.
Thank you so much. Next witness.
Karen Savage, National Alliance on Mental Illness of California. We're also here to support the restoration of cuts to the grants and the cost of living increase. We do recognize that people who qualify based on their disability are very often individuals who live with a serious mental illness. And we also would encourage a statewide approach to application assistance and outreach, and for that include, as Mr. Harold mentioned, people who are being discharged from jails and prisons, and we would add to that people who are being discharged from hospital settings, inpatient hospital settings, and emergency departments, which is very often a place where we can catch people who would qualify for benefits and who would really benefit from those benefits. So thank you very much.
Thank you. Next witness, 1 minute.
Libby Sanchez on behalf of California Association of Public Authorities for In-Home Supportive Services in support of restoration of the grants and reinstatement of the COLA, and just to generally associate myself with everything Mike Harold said.
Thanks. Next witness.
Good afternoon. Carly Finkel on behalf of the Food Bank of Contra Costa and Solano counties. In support of everything that has been said before and after me, and recognizing that food banks like ours and our community partners are sometimes the only sources of food available to folks receiving SSI and SSP. So in strong support of reinstating the grants and restoring the COLA. Thank you.
Thank you. Appreciate that. Next witness.
Hello. My name is Lisa Lopez. I'm with Contra Costa. I don't have big words for you. All I can say is my husband has applied for SSI 8 years ago, and he still hasn't gotten an answer. Okay, I'm on disability myself, and it's just very hard to see the city that I live in with all these homeless people and people who can't make it. I only make $909 a month, and $750 comes right off the top for rent. So I have no money. They say the SSI is supposed to be your food money and this and that. There's no such thing. And when it gets to the point where you see people eating out of dumpsters, you know, someone's got to do something. I know that we help people across the seas and everything, but I think we should help people here and take care of our people first and then help others. Thank you very much for listening.
Thank you very much for coming. Appreciate you. Next witness.
Hi, Nancy Volpert with Jewish Family Service of Los Angeles. Thank you for taking this issue seriously, and thank you for your support. I concur with my friends and colleagues before and after.
Thank you. Appreciate it. Next witness.
Hello. Hi, my name is Emily Wilson. I'm from Alameda County, here with the Californians for SSI. I want to thank you for your time. As the cost of living continues to skyrocket in California, people receiving SSI are still reeling from years of cuts. SSI needs to be increased. However, the governor's proposed increase is less than $20, while SSI has been cut by more than $70 since the recession. SSI needs to be increased to above the poverty level with the cost of living adjustment reinstated. An increase in SSI will mean more money for haircuts, laundry, food, repairs on cars, houses, medications. It will mean healthier citizens, improved well-being, money saved on healthcare costs down the line, more money in the economy, and especially going to local businesses. So increase SSI to above the poverty level to improve lives and communities.
Thank you. Next witness.
Good afternoon. My name is Danny Amaranth, and this is Reginald James Higgins, and we are from St. Mary's Center. We are senior advocates for hope and justice, and Reginald has asked me to share his words with you. First, I'd like to say thank you to our leaders and past presidents who have dedicated their lives to help make our world a better place. Today, I am on SSI and SSD, and with medical bills, electrical bills, water bills, more bills, rent, and food, it's just not enough to cover my basic needs. It's hard to survive until next month. I sell bottles and cans to survive. I utilize the food banks, I eat my meals, and sleep in shelters. Because I accept SSD, I am not supposed to work. But without that income, SSI and SSD just aren't enough to keep me out of homelessness. Today I find myself in an incredibly difficult situation, and I need your help. Please restore the SSI grant funds for me and those in our communities so we can live our lives with dignity. Thank you.
I'd like to say something too.
Thank you.
The SSI have brought me a mighty long way, but without SSI, I wouldn't be here today, and many other folks. So we need to, if you can, pass the bill for us, we'll be very appreciated. God bless. And the presidents that lost their lives for us to make things better.
Thank you.
God bless.
Appreciate you so much. Thank you. Next witness, please, 1 minute.
Hi, I'm Colleen Rebecca with St. Anthony Foundation and also California Hunger Action Coalition. We're in support, and I remember years ago coming into this room when the cuts were being proposed and seeing the long line of seniors and people with illnesses literally crying and begging for these cuts not to happen. And now we're dealing with the effects of that. And we should, of course, be doing everything we can to help people get on SSI, but let's remember that once they do get on it, they're below poverty. Their incomes are below poverty. And for many people, homelessness is an issue that happens as an SSI recipient. And so I'm glad that we have the opportunity to look at this broadly. And I hope that we can see a grant increase this year and sustain it. Thank you.
Thank you so much. Next witness, 1 minute.
Hi, Nadine Paber-Kane, California Alliance for Retired Americans. We concur with all statements made. We are in support of investing in people. Thank you.
Hi, my name is Dan Jordan. I'm a peer counselor at the Central City SRO Collaborative. I'd like to state that people in San Francisco, most recipients on SSI wind up living in the SRO hotels because apartments just aren't affordable at $2,000 to $3,000 a month. So getting into a nonprofit hotel, you're a year on the street, homeless, then you get a reasonable rent. If you're in a private hotel, you're going to pay anywhere from $800 a month to $1,500 a month. And it's just not doable. So I support the restorement of the SSI. Thank you.
Hi, my name is Becky Gershon. I work for the San Francisco Marin Food Bank, and I'm also here with my colleagues from the Marin Aging Action Initiative. And as we were talking about the cost of rent, I just looked up while I was sitting down what the average cost of a one-bedroom is in Marin County, and it's $2,228, which is just absurd. And so, you know, our food bank sees day in and day out folks coming through our pantry lines who are on SSI and who clearly, you know, don't have enough funds to be able to eat 3 meals a day, which is a pretty low bar, if you ask me. So I'm in support of all of these proposals to increase SSI benefits, and also want to say a big, huge ditto to everything that everybody has said.
Thank you. Next witness, 1 minute.
Good afternoon, Tony Anderson, the ARC of California and United Cerebral Palsy, also representing the Lanterman Coalition, all representing people with developmental disabilities. Vast majority of adults are living on SSI, SSP, and try to find a way to survive. We're all, as you could tell, very vast and diverse community, and we all live together to try to make this happen. I want to thank Mike Harold for all the work and his leadership that he's done, but I really want to associate our comments with the story and the testimony of Ms. Taylor, because that was a mic drop for me and for our entire community. So thank you.
Agreed. Next witness, please, 1 minute.
Hi, my name is Ligia Montano with Senior and Disability Action from San Francisco. And I'm here, like everybody else, to support the restoring of the grant cuts to SSISP and also to reinstate the COLA. Because there is a crisis, a housing crisis and a healthcare crisis. And this amount that they receive is just making this crisis bigger.
Good afternoon, Your Honor. My name is Therese Law. I'm with Senior and Disability Action, and I'm a volunteer. I'm supporter of restoring the SSI and ASP grant cuts and COLA. Thank you very much.
Thank you. Next witness, 1 minute.
Hi, my name is Corey Bagoni. I work at St. Anthony's in San Francisco. So I guess I just wanted to comment on how I'm really embarrassed and ashamed that we treat our seniors and those who are disabled this way, one of our most vulnerable populations. So it's something to keep in mind. And just to kind of reflect on this room, you know, for those who are living below the poverty line, it's important to notice that they do not have power in this situation. So for those of you who do have power, I hope that you take advantage of that and do something with it. Thank you.
Thank you, Madam Chair and members. Kathy Sunderling with the County Welfare Directors Association. I think the
folks who've spoken in support of the restoration and the COLA have pretty much said it all. So I'll just lend my support as well to the advocacy proposal. On behalf of the County Human Services agencies, we see so many people that we're attempting to help in our programs who really are eligible and should be on SSI, but who cannot get through that process. They are stymied by the process without someone to help them through it. So that's a really important piece as well, I think, of what we're talking about today. First off, making sure folks who are on the program can survive, but also making sure that those who need the program's help to survive get on it in a timely manner and aren't just left to fend for themselves and eventually, unfortunately, give up, as many do. Thank you.
Thank you. Next witness, 1 minute.
Chair Mitchell, members, my name is Chris Jensen. I'm with Resources for Independent Living, and we are in complete agreement with what was presented on the panel by Mike Harold, and I'm sorry I forget your name, but you did an awesome job. I was with you the whole way. And we also, I'm just grateful for the number of people that came from both near and far to testify today, and I think this is by far one of the best hearings on this subject that I've been in attendance. I was here back when the cuts were being proposed, and I remember being in this room, and I think Mike Harold remembers, I think on one of them we were the only two that spoke on this. And I said, there's nothing in this proposed cut that says anything about restoring the money when the money comes back to the state. And I was told by the chair of that subcommittee at the time, and I think most of the people of that era are gone. Don't worry about it. We'll take care of you. Trust us. It's hard to trust government when they don't follow through on something like that. So we're asking you, now's the time. Our governor signed a bill to make $15 an hour a reality. He understands that sustainable, livable income is important. You got the EITC last year. By definition, people living on SSI cannot work. It is time to provide a livable income on people that cannot work. Thank you very much.
Thank you very much. Next witness, 1 minute, please.
Hi, I'm from St. Mary's Seniors Center. My name is Marion White, and I'm currently homeless, and I've been battling bronchitis since January, and I was ashamed to have to call Walgreens the other day and tell them I couldn't afford my medicine till next month, and it's medicine that I need for my bronchitis. And I say ditto what everybody else says. Restore our benefits. Thank you.
Thank you very much. Appreciate you coming. Next witness, please. 1 minute.
Hi, my name is Constance Faulkner. I'm from St. Mary's Center, and I am homeless. So I would appreciate it if the cuts would be restored. Thank you.
Thank you very much.
Hello all, my name is Joseph Berry with Disability Organizing Group for Initiating Total Equality. I'm also here on behalf of the Coalition of Californians for SSI. And I just want to say that I'm tired of worrying about shelter, tired of worrying about food, tired of worrying about independence, tired of being blamed, tired of being scapegoated, tired of being the reason in the face of poverty. I'm tired of asking, I'm tired of hoping, and I'm tired of needing. And I'm tired of just needing enough money to live independently and with dignity. I'm asking you to please undo the cuts that should not have been implemented in the first place and take an ethical approach by restoring, putting us back above the federal poverty line and also making sure you return the COLA. Thank you very much.
Thank you very much.
Hi, my name is Robert Cope. I'm a Dogfight member and Shock member. Both organizations are in Sacramento. And back in 2007, 2008, we were living at 102% of the poverty level. Now it's only almost 91%. Money's gone down, rent's gone, everything is going up. We need the cost of living increase restored. I mean, people are actually dying on the streets or going homeless because of these cuts. Thank you.
Thank you very much. Next witness.
Good afternoon, Senator. My name is Arthur Hutchison. I'm a member of St. Mary Senior Home and Justice. I'm here to support the bill of SSI, and I will ask you to give it a thought to restore the bill above poverty level. It can be used for us all. Being a senior, we doesn't have it easy. Yesterday, I tried to do a little work around the storage, and I bumped my leg. This morning I woke up, I was crippled. What good would it do me to come out of retirement in my age? So I hope you increase the bill in SSI for us all.
Thank you, sir. Appreciate it. Next witness, please. 1 minute.
Good morning here. I'm here for St. Mary's Hope and Justice, and I'm here to support the bill that we're trying to pass. Thank you.
Thank you.
My name is Sister Marilyn Meadow from St. Mary's Center Family, and thank you all for having us today and for listening. I also was around when the cuts happened, and I'm here to say ditto to everybody, certainly, and to ask you to really consider the restoration of the cuts and COLA. People you've heard our folks, you've heard so many other folks. Homelessness is increasing. Come down to Oakland, come visit St. Mary's. Thank you for listening.
Thank you for coming. Next witness, 1 minute.
Good afternoon, Madam Chairman. My name is Barbara Coleman, and I live in San Francisco, but I live in the poorest part of San Francisco, which is the Tenderloin. My rent has been gone up. I don't receive much on SSI, which is $95 a month when they did the cuts, and that's all I have. I took a part-time job, and I get $59 every 2 weeks just to help to get the groceries and stuff, because when I pay the rent, I don't have any more. And I'm partially blind and have to go to the doctor all the time. Thank you very much for listening, and I hope you restore the cuts.
Thank you very much for coming. Next witness.
Good afternoon, Madam Chairman. I'm Charlene Davis, a Vietnam vet. In the SSI, I take 16 pills a day for life-threatening medication, 9 medicines a day. And I have to properly eat, and I'm unable to buy the proper food to eat. And it's just really sad, not only myself, and it's just, we need, we seem like we don't matter anymore. The people we need you. And California, I know is not broke. Help us, please. You all have a blessed day.
Thank you, you too. Next witness, please, 1 minute.
Honorable committee members, my name is Janie Castillo. I'm the Hope and Justice Coordinator for St. Mary's Center. I know that we are framing this as a budget ask, but I'm not sure why, because I feel it is a debt owed to our people. It is money that was borrowed, and now it is a debt that the governor needs to pay back, just like he did so well at the beginning, closing the deficit. He must have forgot about this. And so we are asking now to pay us back, our seniors, our disabled, pay us back. We don't need the money all at one time. We're willing to take it over 5 years. And so thank you so much to consider this.
Thank you very much for coming. Next witness.
Yes, I'm Eleanor Block, and I'm with the California Senior Legislature and the Marin County Commission on Aging. And I just want to ditto what is said and what Senator Monning said about having a way that those that are struggling to get SSI, a quicker form, that would be very helpful. Thank you for your efforts today.
Thank you very much for your attendance. Next witness.
Sybil Boutillier. I'm a member of County Commission on Aging in Marin. I just wanted to mention that the Bureau of Labor Statistics says that since the COLA was repealed in 2011, the Bay Area CPI has increased by 18% if you don't include food and energy, and then it goes up to 21%. So another important index to look at is the Elder Economic Index. And for the County of Marin, for a single person renting, a minimum is almost $30,000, $29,000+. And so even if you brought it up to the federal poverty level, which I hope that you will at least do, there's still a $1,500 gap for somebody to be able to meet their basic necessities, which The CPI only allows 4% of that for medical care. We know that it's more than that for most people. So this is really the lowest low bottom number. If you can possibly get to the federal poverty level and go up from there, it would do everybody a lot of good. Thank you very much.
Thank you.